that kind of comes to mind for me is recognizing that your loved one, just like many of us, are on our own healing journey. And no two healing journeys, are going to look the same. And so my recommendation here would be that, we allow that loved one, that person that we care for, to exercise their own self-determination. So they need to be in the driver's seat for how they want their healing journey to kind of go, how they want treatment to look. If they want to move away from using toxic street drugs, they need to have the power and the autonomy to create that plan, to say what's going to work for them and what's not going to work for them.
Yeah, I think the only thing that I would add around what Len was just sharing was, we really have to have conversations around the help that is available for people. And I know this is kind of it's a politically charged, it's emotionally charged topic for some people, because, there is a certain group of people, for example, who believe that abstinence only is the way to go. And, we have always believed in supporting First Nations people on their healing journey. As Len said, whatever that they choose for that to look like for them. And harm reduction can literally be on a spectrum. So abstinence for some people is what they choose and what may work for them. But that may not be everybody in that situation. And I think, we have to spend a lot more time, I think, having those conversations. Also, reducing the stigma around substance use and the internalized stigma that people feel can be a barrier for people. When they've decided to make some change, that can be a barrier for them to moving forward. If they see themselves, if it's just they're full of guilt and shame for who they are, and that's feeding that stereotyped idea we have in our head of who people who use substances are. So we need to challenge that. But once people move forward, we have provincially, and including for First Nations people now, we have a whole range of harm reduction services and treatment services, including opioid agonist therapies that are available. Because of the dual public health emergencies, we are now working on initiatives to have nurses and registered nurses, registered psychiatric nurses to be able to prescribe opioid agonist therapy for now. And there's also an initiative provincially underway that's talking about what we call safe supply or pharmaceutical alternatives. So and that really, the intent of that is to separate people from the really toxic drug supply that's out there right now. And we also have other resources at First Nations Health Authority, including our First Nations virtual psychiatry and addiction medicine program that people can access directly. So people can access and see a specialist directly, though virtually. And also people who work with people who use substances can access this service in order to get some clinical guidance or support around working with people who use substances. So, and then we have, of course, FNHA funded treatment centers for those who choose to do that. And many of the treatment centers include, culture and traditional activities, ceremony, and also are inclusive of people who are currently on opioid agonist therapy. So, the answer to that question really is, there are, when help is wanted, we are looking to expand the help and accessibility across the province, but it is there. But what we really need to, overcome is the stigma and shaming and internalized stigma that people feel, because that can be the biggest barrier to people seeking help.